But then, when we look at the workload that they have and the type of stresses that they're going through, this study has brought to light so many things that the nursing profession suffers from. And of course, unfortunately, India is lagging behind in studies on what affects the nursing profession. Nothing is really being done to resolve their problems. Globally, there are a lot of studies, but surprisingly, in rural Maharashtra, we had some study which showed that nurses suffer a lot of musculoskeletal disorders and needle stick injuries. Musculoskeletal disorders are because of the type of work they're doing, the long hours they're working, and how they deal with the patients. And the needle stick injuries is simple, like when they're giving injections or they are removing the syringes, they are also hurting themselves in the process. And today, a needle prick can transfer so many diseases, right from jaundice to AIDS and so on. So all this is absolutely neglected. Neither the nurses are aware of it, but nothing is done about it. So we are looking at the musculoskeletal disorders. As I said, it's just a part of the study. So let's go ahead. So the work-related challenges have been increasing. Why? Because they have increased workload, long duty hours, reduced staffing, and increased overtime. Overtime is sometimes taken on by the nurses because they can make a little more money, and increase in the patient length of stay. So longer the patient stays, longer the nurses have to work, and less the staffing pattern. So therefore, this is one of the causes that could give rise to a lot of problems. Plus, of course, emotionally, they are doing extra work for money to maintain a decent home, improve their standard of living. Shortage of staff also, it's like an incentive. So you work more, you get more money, and they have very limited access to claims and compensation for occupational hazards. So that's the justification for the study, where absolutely this is a neglected group. They are called as workers rather than healthcare service providers, and actually they are the ones who also need to ensure that they have good health, comfort and safety protection, which is neglected by most of the hospitals. We have done the study in government hospitals, semi-private, private clinics, and everywhere, most of the time the results have